Welcome to the Human Capital Innovations Podcast, your go-to source for personal, professional, and organizational growth and development. We hope you tune in often for all things people management, organizational development and change, organizational leadership, and social impact related. Maximize your personal and organizational potential with Human Capital Innovations Podcast. Welcome to the Human Capital Innovations Podcast. In this HCI podcast episode, HCI Research Associate Dr. Leandra Hernandez and her colleagues continue their weekly COVID-19 Convo via Facebook Live to discuss all things COVID-19 related.
Yeah, it feels like it's been forever already, but I don't see it coming to an end anytime soon.
Yeah, the beginning of what seems like forever, huh?
Yeah. Of course, I mean, on the one hand, it is ending, right? I mean, I'm in a state that said, we're reopening. We've only got 45, 48 deaths a day, so let's just reopen. On the other hand, I realistically don't see that happening soon at the workplace and so on. And I certainly don't see myself going into crowded restaurants at this point.
Yeah, they're reopening bars and restaurants on tomorrow, actually, here in Ohio.
Yeah.
Oh, really?
Yeah, but I will not be going to them. I think outdoor seating opens tomorrow, and then a week from tomorrow, indoor seating opens. So. I won't be going. I just went to the grocery store today and was alarmed at how many people were just right next to each other, groups of adults shopping together, getting way too close to me. Mm-hmm. I definitely, my full inner germaphobe came out and a little panicked. A lot of people wearing masks, but pulled down around their chins.
Under their nose.
Pulling them down to talk and then putting them back on again.
It's the whole point of wearing them.
It's just don't wear the mask if you're going to do that, right? I mean, I don't know, maybe, I guess, wear the mask, but yeah, it was alarming.
Yeah.
It's been interesting here in Utah. I feel like everyone, at least in the Salt Lake Provo area, I feel like everyone has been really good about following a lot of the guidelines and the recommendations. Even at the grocery store, I'd say the majority of folks were wearing masks and following the spacing guidelines. So it's been really heartening to see that. Yesterday, for example, our university's president had her semester talk that she gives every so few months. And some of the data that she presented said that I think the state of Utah has the second lowest mortality rate in the country so far.
Wow.
And I mean, just kind of observing people when we've been going on hikes or just at the grocery store. I mean, even when we're in the outdoors, right? People are very good about staying very far away. So that's good news so far.
Yeah, that's very good. I wonder to what extent the position of the LDS Church is helping with Utah, because I think the LDS Church has taken a pretty pro-science, sensible perspective on this, but I don't know very much about it.
Yeah, that's a great point, Pam. I've been so blessed to talk to so many of my students over the last 2 semesters about the LDS faith and how a lot of their religious principles inform their public health practices, whether that means stocking up on materials beforehand or following really good preventative health measures. And I mean, I don't have any data on that, but I think anecdotally, it's a very positive factor.
Yeah. I'm just thinking of the kind of political polarization that we're seeing in some places. I mean, I went to the grocery the other day, and most people were wearing masks and trying to be observant and follow the little arrows. And then there were a few people who were clearly militantly not wearing masks and walking the wrong way and getting close to people. And it was creepy, actually. Mm-hmm. But it was also clear that the employees were not going to challenge them, were, a little afraid of what they would do. And these were not intimidating people. These were like middle-aged women, white women, of course. But I mean, it wasn't like they were gun-toting or anything like that. But there was clearly a sense that, the employees didn't want to confront them.
Yeah.
So, and I do think that has something to do with the newscasters they're listening to and the media they're consuming, that I think even, in Utah is very conservative, but I don't think they consume that news in the same way.
I think that's a great point. Definitely a great point. Especially when we think about the reluctance to confront individuals who aren't following the mask mandates, and how in a few isolated cases that's resulted in violence, right? I mean, I was just reading about the case a few days ago where I believe an individual got shot in a gas station, I think, where he told the person coming in that they weren't allowed to enter without a mask. And then an outbreak happened. And, it's definitely concerning when you think about the right that individuals feel to not wear the mask or not follow any of the mandates, right?
Right. Yeah, it's really frustrating to see that stuff on social media. But, what was encouraging is that I recently read an article, I think it was on CNN, that said that polls show that most people agree that we should be following these standards. Yeah. It's a small vocal minority, and it kind of gives you the sense that there are more people out there who think that than maybe there are. But of course, you've got a few really loud media voices boosting that kind of behavior.
Yeah.
It was interesting looking at the sort of the difference between, like you said, the sort of militantly anti-distancing people and then the people who were just sort of doing a bad job of it. Like, and I was at the post office today picking up my mail, which has been held for the last 2 months.
Yeah.
And the woman in front of me was signing, she was mailing package, she signed the thing, she touched the console thing and the communal pen, and then she had a mask on, and then she was just talking to the male employee, and she just pulled down her glasses and started rubbing her eyes. Yeah. And I was like, you just touched the thing. Obviously I didn't say anything because it was just like she forgot, but
it's unconscious.
But then there was one particular group of people at the grocery store that I was at today who were just walking it was a group of 3 adults shopping together, and kind of walking all around and taking up a whole aisle and getting really close to people and, kind of clearly just kind of mocking everyone like me who had a mask on and was sort of kind of actively running away from them.
Right. It's like physical trolling behavior.
Yeah.
The physical equivalent of online trolls. And now we're in the store.
It's scarier, right? Because they're right there. So they definitely were laughing at me as I sort of ran away from them. But I felt like they were following me, they were right behind me. I was like, no, get away, I'm taking part over here. But yeah.
Well, Zoe Knudsen, if I'm getting that name right, says in the chat that on Kauai you cannot enter a store without a mask, and they've had. I think Hawaii's been handling it pretty well generally.
Mm-hmm.
Yeah, that makes sense. I wish we could see more of that in Florida. I think there's a combination there. The trolls that you're talking about, the ones who are sort of like militant about not wearing masks and kind of pushing other people's buttons. But there's also a lot of people who I think just don't understand.
Yeah.
Like, I'm not sick. I'm not wearing a mask. I'm not afraid of getting it. So they don't understand the whole, like, I'm wearing a mask to protect myself, to protect you, not myself. But I had a conversation with someone online the other day. She says, are you telling me that I'm supposed to wear a mask to protect other people in case I'm sick, even though I don't have symptoms? And I'm like, that is literally exactly the point.
That is the part of the entire issue.
I guess I sent her the CDC link. I copied the pertinent text. Like, yes, that is exactly right.
It's kind of like with this. Sorry. What'd you say?
Leanne?
I thought it was Pam. Pam, were you saying something?
Oh, I just said, yeah, I was just finishing that story.
Yeah. It's kind of like the flu vaccine. I think it's hard to convince people to get the flu shot if they think, well, I'm not worried about getting the flu. Like, I'm fine, I'm healthy and young. It's like, well, this is something you do as part of a community to kind of lower the incidence of flu across the whole community and reduce the risk for other people. But it's hard to get people to do those things.
So Laura presented a question that I think kind of gets at the heart of this, where she says, why do people put rights first instead of considering like health as the most pressing issue? I mean, I know I say this every time, but I really do think it goes back to cultural values, right? Like when we think about individualist cultures, approaches to our own rights versus those of the society. And this also goes back directly to what Pam was mentioning, right? About how I think a lot of individuals don't even think about public health from the larger collective perspective. I mean, that kind of gets at the heart of the whole idea of wearing masks to prevent transmitting it to someone else, even if someone doesn't think they have it. If it's for the greater good, as they say in one of my favorite movies, like I feel like if we kind of use that approach to like at a lower level, maybe not so much a public health mandate perspective, but even just talking about your health and your conversations with your doctor, right? Like what would that look like if we frame that more collectively to start changing those health behaviors at that more micro level?
Right. People understand it, or better came to understand it when smoking became a topic of conversation, when it became secondhand smoke, because everybody's like, I have the right to smoke. It's my health. It's my life. It is, of course, it's a collective cost for those who treat, because treatment, is expensive, and we pay that in increased premiums and taxes and so on.
Yeah.
But when people started talking about secondhand smoke, then it became more like, okay, so if I'm smoking in my home, my children are affected, and people started to understand that a little bit better. But it's still that, that idea of, oh, it's me and my children. I don't want to endanger my children, rather than, you owe something to society. There are things that we do for everyone. And it's not just, you're not just an island, an atom floating in space with no impact on anyone else. We all rely on public goods all the time. We rely on roads. We want there to be roads. We want there to be bridges that don't fall down. And public health is one of those public goods.
Yeah. So y'all know I'm into pop culture, right? I like following it. I like teaching it and talking about it. And just yesterday, I was rewatching Glow because I love wrestling, and it's one of my favorite series on Netflix. And in one of the episodes where the whole team is in the hospital, the doctor is in the room smoking, right? And it's set in the early 80s. And I told my husband, I was like, wow, this, friendly reminder, like back in the day, you could actually smoke in the hospital, or you could smoke at restaurants. And Pam, when you brought up your point earlier, that's exactly what I thought of, like framing the whole secondhand smoking thing. Because I remember in Texas, like more specifically in Houston, at least, when the mandate came out that you couldn't smoke at all in restaurants inside on the patio period, people flipped, right? And I just think it's a really interesting parallel from a public health perspective to think about like rights in that context versus rights in COVID, and then how legally or institutionally that starts impacting other sectors and other industries, right? Super interesting.
Yeah.
And even when we think about rights, we can, a lot of people are saying, I have a right to do this or do that, to go out, to have my business open, these rights. But then you can also frame that conversation in terms of what are your rights to health as a citizen, like, do I have a right to not have somebody breathe smoke in my face, right? Like, what are like those go both ways. Or like, do, you know, whose rights get prioritized over other rights? Like, do meat packing plant workers have a right to stay home and get paid, you know, while they get paid to quarantine, basically? Or do they not have those rights because I have a right to have a hamburger, right? Like, what's the...
and where does it end, right? Because it just snowballs.
Yeah. It's interesting. I mean, there are certain things that we take for granted. Like I said, public roads are a public good, and you can't go out with a jackhammer and destroy a road.
Right.
That would be a crime.
Yeah.
We all agree as a society that people should wear pants, and everybody wears pants, and nobody says, or almost nobody says, you know, you are oppressing me and this is unconstitutional and I'm going to run naked through the streets. But the mask suddenly is not like pants. And we're not sure why it's not like pants, but it's just not. And it reminds me really of the 19th century, where you have the birth of public health as people started to understand that, you know, health wasn't just a matter of individual choices or individuals having something going wrong with their body, that there were these infectious agents out there and that your actions could affect other people and vice versa. And that things could be transmitted through the water. And so you started having, it's a harm to me if someone pollutes the water along the river. And that was a kind of new, you know, amazing thing to think. But we're not as good getting away from non-infectious diseases. First of all, we still tend to think of cancer as really, that's an individual problem, not a public health problem.
Right. Not an environmental concern by any means, right?
Right. Or mental health or what have you. But here's an instance. I mean, this is sort of made for public health, right? It's an infectious virus. You know, it's very infectious. It's squarely in that bailiwick of public health. And yet we're seeing all of these kinds of responses. I mean, the demonization of doctors, the demonization of out groups that we've seen since time immemorial, when the science didn't exist and people really didn't understand why these things were happening. Now we understand it, but we're still going through the same narratives like it's 1385.
Like that could be a song lyric.
Yeah.
Candida has a great question. Candida, it's so great to hear from you and to see you, even if only in a technological context. So Candida's question says, the goal in the beginning was to flatten the curve and to make sure that hospitals were not overwhelmed, right? And the closure was to help with that. And now that hospitals are not overwhelmed for the most part and are able to handle the cases, we're starting to see a lot of media outlets say that there's going to be a lockdown until we have a vaccine. The flu shot doesn't eliminate the flu, but it helps, right? And we can also have a really productive conversation about the role of vaccines and how long they take, right? So Candida's question is this: are we at the point now where we as a society are doing more harm than good with the closures, right? And some of the broader implications of that. So yeah, what do y'all think? Vaccines, closures?
Jen, do you want to lead us?
I was just going to say, I don't think that there will be, I don't know, you know, what this is particularly in response to, but I don't think that there's going to be a lockdown, or that, I mean, here in Ohio, we're already opening up. So like, there's not a lockdown anymore until a vaccine eradicates the virus. I don't think that's going to happen anywhere. I think it's going to be more a matter of like control and mitigation and being careful. So, I mean, that was just what I was responding to, is I haven't heard anywhere anyone advocating for a total lockdown until a vaccine arises. And I agree that that's not feasible because it could be a year, it could be a year and a half. I mean, I don't think anyone's really super advocating for that.
Florida's opening up. I believe we will probably be forced to withdraw from that. I believe we're going to see cases go up, and we're going to have to withdraw from that a little bit. But I mean, certainly we're not going to go to lockdown. I think the idea was lockdown to break the curve, to get the R0 under 1, right? So that each person is infecting less than one other person or only one other person. Right. Get people to wear masks for the same reason. but also to put into place testing and contact tracing so that if you reopen, it's whack-a-mole, right? You reopen so that most things can kind of function, but then one person gets sick and you're like, okay, we found you, we tested you, we know you have it, who have you been in touch with? Okay, those people need to know so that they don't spread the virus.
Yeah.
And so we're going to find those people and tell them and find out who they've been in touch with and see if those people get sick. And if they do, then we know, okay, now we have an outbreak. But people who are not sick can continue to go about their business. And you're absolutely right. We needed to tamp it down in part so that we could get the hospitals, first of all, they could ramp up their ICU capacity, but also so that they weren't overwhelmed. And we've achieved that. But if we don't do testing and tracing, we're just going to see lots more little bumps.
Yeah. And I think we are going to see lots more little bumps. I think that is what's going to happen, right? Like, even it's just going to be a long process of kind of managing and, like you said, whack-a-mole and figuring out. I mean, it's a big risk management puzzle, right? How do we decide what is worth taking a risk for? What's too risky? How to minimize the risk when we do reopen things? And I think, and this is the thing that for me has been kind of stressful, that I've started to realize, I think probably belatedly, is that this is going to be what's going to happen for a while until we do have a vaccine and can really attack it at that level and really minimize the spread.
I mean, the good news is we're learning so much so fast about this disease that, for every month that people don't get infected and don't get sick, they're that much more likely to get really good care that actually keeps them from getting more sick, right?
Yeah.
And we know so much more than we did even a few months ago. Yeah. Oh my God, oxygen deprivation put everybody on a ventilator. Oh, well, wait, ventilators are actually doing more harm than good in some cases. So now, now give supportive oxygen, but maybe don't go all the way to the ventilator until you have to. So, the learning curve has been straight up. But for everyone who we delay getting sick, even if they get sick down the line, the care that they get is going to be so much better.
Yeah. Oh, yeah.
More likely to survive.
Yeah. And I have two thoughts to that too, just more generally. So Jenn, your statement earlier about how everything is risk management, like I'm thinking about this not only as it impacting local industries and small businesses and hospitals, but also how it's impacting academia, right? As like larger university institutions are thinking about whether or not they're going to be online in the fall, whether or not they're going to be online in the spring, and what that looks like from a risk management perspective on the back end as we're getting new updates about COVID, like literally every day, right? And we're trying to make sense of what it's going to look like in a year. Amy has an excellent statement here. Amy, we always love to hear what you think as well. Amy says, I'm a cancer researcher funded by the government agency NIEHS, National Institute of Environmental Health. So she disagrees a bit. And Amy, if well, I think what we were talking about with not viewing cancer as an environmental or like a population-wide kind of problem, right? Yeah. That's what I'm guessing.
I didn't mean that the government agency didn't view it that way. I just meant that ordinary people still tend to think of it as an individual problem rather than a public health issue. But maybe that is changing as well.
Mm-hmm.
Yeah. Yeah, and I was just gonna I'll just plug a podcast that I keep listening to, which is called This Week in Virology, and they keep having visits from Daniel Griffin, who I believe is the head of the emergency department at a hospital in Brooklyn, and he is giving updates, like weekly updates about the clinical care and what they, kind of the consensus about what is the best clinical care. And it has been really heartening and really cool to hear the progress that they're making as they figure out, just as they see more cases and they figure out more of how to deal with this. So I think you're absolutely right. That the curve of knowledge is going up exponentially, and we're figuring out, and doctors and experts are figuring out like what to do. And care outcomes are going to improve as that happens. And then that eases some of the load on the hospitals. And so that's all good news.
Yeah. So environmental issues, environmental causes of cancer are a public health issue, or should be a public health issue. And of course, we know that many cancers are caused by viruses now. For example, cervical cancer. So, and now there's a vaccine, and it's also about educating people about the vaccine. So yeah, these definitely should be public health issues.
Mm-hmm. Yeah, and Amy's saying she speaks about the environmental effects of cancer throughout her community and via the city's public library, which is awesome. Yeah, I wish we had some kind of function where we could just,
I know,
and she could say it. But yeah, I think that's really cool.
Well, maybe she can come on.
Progress. Yeah. Yeah.
Awesome.
How are things open for you, Leanne? Are things in Utah?
Yeah, so it was kind of similar, seeing the parallels between Texas reopening and Utah reopening. It was on the same day, actually. So kind of the idea of things opening up in waves, 25%, different phases. So certain industries are opening up, but not to full capacity. And, like restaurants and things of that nature. Climbing, y'all know I climb, right? So the climbing gyms are starting to open back up, but I haven't been yet. And I don't know when I'm going to go, because I don't know. It kind of goes back to the first point we had earlier in the beginning where, people aren't following the rules and they get too close to you and you get a little spooked.
Yeah.
It's kind of like that residual fear, right? I mean, these are all of my friends that I've hung out with for the past year, but I don't know, it kind of makes everything that felt so normal, everything that was part of your normal life. Now you go outside and you're just kind of like, well, should I be here? Do I want to be here? How long should I wait? So yeah, long story short, things are starting to open up in small phases.
Yeah. We went to, it's a big state. And so, people are doing different things in different places, but we went to like 25% of restaurants, and then, opening. And now they're saying, okay, well, it's been days, so let's go to 50%.
Yeah.
We're just doing it all in Ohio.
Yeah. I mean,
going for it.
What one should be doing is like waiting to see if the numbers go up. And of course, to wait to see if the numbers meaningfully go up, you have to wait a few weeks.
Right.
But in fact, nobody's doing that, and they will go up. I mean, our numbers never really went down. Not very much.
Ours are still going up.
Yeah. So, and of course it varies very, Miami has big numbers, and they actually may have bent the curve, but in the more rural areas, it's been steady and steadily increasing, not exponentially, but just kind of on a steady rising arc.
Yeah. I keep feeling I've just been thinking a lot about the differential ways that this is impacting people, and the way that because of my job and where I live and stuff, I have the ability to just stay home. I got really freaked out at the grocery store and felt, like this is too close. Nobody is paying attention. And
Yep, we lost Leanne.
Oh no. But I have the ability to just stay home and not go back to the grocery store for a while and not go to anything. And, just thinking about the workers at the grocery store and the people for who don't have the option really, about whether to go out and thinking about that.
Yeah.
More comments.
Yeah.
Oh, that's a question for Leanne, and she just
appeared. I did say earlier that she felt that most people were using common sense and using a mask in Utah. Candida asked, do you think there should be mandatory testing, and why? I don't know yet exactly what I think about that. I mean, I certainly think that there should be widespread testing, but I don't know how, because we have so many tests some are more effective than others, and it's hard to tell. Yeah. I'm not sure exactly what it would mean to have mandatory testing, or how useful it would be, and whether that should, I mean, first of all, we don't have the reagents, we don't have the supplies to do mandatory testing of everything. We just don't. Yeah. So, and how often would you do it? But certainly for some industries, certainly mandatory testing of anyone who's been exposed and knows they've been exposed should, before they're allowed to go back to work, should be, I think, a requirement. But that question was from Mrs. Hernandez. Where is she at? I don't know.
I know. She just disappeared. Lost her internet connection or something.
Yeah. Oh, Leanne messaged the group. Here we go. Trying to come back. Carrie K, do you have to let me back in? So she's trying to come back.
Okay. What happened there? Yeah.
Yeah. Hopefully the internet cut out. Yeah.
Yeah. Yeah. I'm not sure about the testing. I mean, it's another one of these communications challenges because, you know, when you do testing, there are always going to be false negatives and false positives, and different tests have different rates of those. And some of them have a really high false positive rate, and some of them have a real, you know, that are less sensitive will have false negatives. And so I wouldn't want us to be in a situation where, you know, I mean, people have talked about like the immunity passports, which I think there's the reasons why that might be bad are obvious, but you know, there are lots of reasons why that might be bad. But one is that we don't know, you know, for certain if somebody is immune just because they've had a positive result on a test.
Right. There was a report just last night in Los Angeles or yesterday in Los Angeles of a woman who recovered and is now back with it. And it's of course hard to tell whether she was completely recovered, whether this is flaring up of an existing, but we don't know. And as we were saying last week, the military is refusing to take people who've been hospitalized with COVID, and explicitly have said that part of that is that they don't know if it makes them more vulnerable to future infections to have had it once. I know that's the case with, well, I don't know that that's the case. I understand that it's the case with dengue, for example, that if you get one kind and you get a second type, you can be much sicker than someone who's never had it. So I don't know if that's what the military is thinking. I have no idea what they're thinking.
I think actually they haven't decided on that policy yet. There's some debate within the, my father, who works at the Pentagon, was very surprised to see that on the news. So it's like, that's not been decided yet. So I think there's still debate about like how that's going to work out. But it's true. It's complicated. I mean, I think for sure the more testing gives us more information, and more information is great. But we're still going to have to do so many of the things that we've already been doing to kind of minimize it. Plus, we don't know, you know, you could get tested. It's not like a one-off thing. Like I could get tested today and test negative, and then I could go to the grocery store tomorrow, get infected. And then, you know, if I say, oh, I had a negative test, it's like, well, you could still be positive, right? Just because you tested negative one day. So,
as we've seen happen. It looks like we're trying to get Leanne on. Yeah. I think Daniel is trying to get her back into the room, but
okay, yeah.
So, so we don't know exactly. Amy says the antibody load is low and isn't expected to last lifelong. There are no true cases of second exposures yet.
Yeah, Amy, we've got to get you on here. But yeah, I think I heard the same thing, that in cases where it appeared to be a reinfection, here we go.
Awesome.
Yeah.
Wow. It's way harder to get back in here than I thought it would be.
But yeah, it was just to finish that sentence. I think the, in cases where there appeared to still be, where there's appeared to be something like a reinfection, it was actually just viral RNA still present, which doesn't mean
Well, but this was a rehospitalization for some.
Yeah, I was thinking of another case.
Yeah. So there have been cases where people have been declared recovered, and then this was in Los Angeles, a woman who was rehospitalized who got much worse. So that was the headline, was that this was a second infection. It's again, I'm not sure. Did the viral load drop so much that they didn't see it on the test and then it spiked again?
Right. Or could it have been a false negative or something, right? Like we don't, so.
Right. But we are seeing a lot of weird sequelae out of this virus. Now, of course, the children with something like Kawasaki's is getting a lot of attention. So the thing is, there's so much we don't know yet, and we're learning every day. And the great thing is that everybody's focused on learning that information. But the not so great thing is that we don't really know what the risks are. Laura says, how can we say that we flattened the curve if there were 1,200 deaths yesterday, a very abnormal normality? People are losing sensitivity, and that's sad. And I think that is true. We really are. It frightens me that we're starting to think of these numbers as, well, that's just in the noise. That's what happens. And I do think that will change as more people know someone personally. But it is really frightening that we're starting to see this as normal. But look at what has happened with gun violence. I mean, I can tell you that when I was in my 30s, which was a while ago, no one would have tolerated this level of gun violence. A school shooting was like, people would talk about it for months. It was a huge tragedy. Everybody mobilized. Now there's a school shooting. Well, not now because we're under lockdown, but or modified lockdown. But now there's a school shooting practically every day. So people can get used to tolerating pretty high numbers of things that we shouldn't be tolerating.
Yeah.
I mean, can you guys hear me? I think I'm
on.
Okay, the whole screen has gone black, but I can still hear you guys.
Yeah, I can hear you. It's just your camera froze.
Okay. Well,
Yep. And I'm losing battery, and I can stay on, but I need to get my cord. So I will leave you on alone for a minute.
Leave me on alone. Go team. Amy, when are we going to have you join us? That would be so much fun. Also, because I haven't seen you in like 12 years, which is wild. Lauda, I think your point is spot on. And I think it speaks a lot to how culturally, I think we have become more desensitized to a lot of these things over the last several years, with the increase in gun violence, more specifically, violence more generally, and also the number of deaths we're starting to see from this particular pandemic. I think being desensitized to what we see in the media, and also just kind of becoming desensitized to things more broadly, for some could be a distancing mechanism. Your Pam's back. It could also be a coping mechanism too. Let's see. So we got Jen says, okay, now her computer's frozen. Today is the day of technology issues.
Yeah, we were actually pretty close to our time, but what do we do about this? This idea that maybe it's fine to lose 1,200 people a day?
I don't know. I think about how people make sense of that from a utilitarian perspective. I think about how people make sense of it from a coping perspective. And I think phrasing it as the abnormal new normal is kind of the reigning framework to think about it. And personally, I try to not be super pessimistic or desensitized to a lot of these things, but as a health and media comm person, it's hard for me not to be. So, I feel like my perspective on that kind of shifts and ebbs and flows depending on what the week is presenting us with.
Yeah, I think that's true. You can certainly see that there's a kind of rhetorical shift, a political rhetorical shift to, we're warriors for the economy. kind of stuff. The lieutenant governor of Texas saying that, people over a certain age would certainly be willing to give up their lives for the American value of the open economy. That seems to me to be a false dichotomy. I mean, I think there are ways to do both. Other countries are managing it. But
yeah, I can't. So Candida, your point about the media, which is something we've been talking about this entire spring semester. Candida was one of the brilliant minds in media ethics with me this semester. So we had lots of amazing conversations. And y'all know, I always think on the one hand, the media is an easy scapegoat for lots of societal ills. But then on the other hand, I think that there are certain news outlets and certain kind of journalistic trends that don't really make the case easier for themselves, right? So I would argue that from the point of view of the media, overanalyzing or overstimulating with dramatic reporting, whether that be to gain likes, to gain social media trends, or even just more generally, kind of from an ideological perspective, I do think that there are certain outlets that are not covering COVID in the most effective way, particularly when we think about information literacy and science literacy, and the viewers who are just inundated with messages all day, every day. Yeah, we should talk about that more next week.
Absolutely. Well, I'll leave you with the thought that Fox News, which is urging everyone to get out and restart the economy, has extended their own shelter-at-home orders until mid-June. So you should get out and stimulate the economy, but they're not going to.
Right. It's a whole and the covering versus the personal, individual, intra-institutional mandates, whole other story, right?
Yeah, exactly. Well, thank you for hosting this time, Leanne, and I'm sorry we lost Jenn and we lost you, but we got through it. It was always fun and really interesting to talk through these things.
Yeah, I want to point to Jenn's comment just real quick, where she says, "I think it's hard for people to conceptualize 1,200 deaths a day. Yeah. It's hard to mourn en masse, and it's easier to just call it normal, shut it out, or imagine it's a big hoax." Jenn, I think you're spot on with that. It's a coping mechanism to a certain degree, right?
Right. Absolutely. And I think that's, that question of scale, it's 1,200 people. It's too huge. We don't know them, or not everyone knows them. And it's too easy to just think, okay, that's too big a problem for me to take into my head, but eventually everyone's going to know someone.
Right. So,
well,
all right, everyone. Next Thursday,
and hopefully we'll all have great Wi-Fi connections.
I know, right? Stay happy and healthy, everyone. We'll see you then.
All right. Bye-bye.
Bye.
Thanks again for joining us for this episode of the Human Capital Innovations Podcast. I hope you stay healthy and safe, and that you have a great week.